All right, guys, we're in Encinitas, California, with one of the world's leading experts on gluten sensitivity and celiac disease, Dr. Tom O'Brien. Welcome to the show.
Thank you.
Dr. Tom, how did you become such an expert on gluten sensitivity and celiac disease? That's not something that a lot of people study.
I was at a seminar in 2002 with Dr. David Perlmutter, a neurologist from Naples, Florida, and he talked about 10 people who had migraines so bad they couldn't work for an average of 8 years. They'd been out of work. And I thought about what's the impact on the family and the kids in a home like that where it's shh, dad's got a headache, shh. How are these kids growing up? Are they suppressed? Are they not able to feel the joy of life? And you can only imagine the sorrow in the family. These people want to work, but they couldn't. They were sent to the Workmen's Compensation Board, so these people were not malingerers, they really were suffering. They sent them to this one doctor, he checked them, they all had gluten sensitivity. He put them on a gluten-free diet, not celiac disease, gluten sensitivity. Put them on a gluten-free diet, 7 out of 10 never had a headache again. 2 out of 10 had partial relief, the 10th one refused the diet.
Wow.
So I ordered that paper that Dr. Perlmutter talked about, I read the paper, and then I looked at the references in the back and ordered those papers and started reading, and I've been reading ever since.
It's just endless, huh?
It's endless.
What is gluten? I'm sure our audience out there is thinking, what is gluten? They see gluten-free things all the time. What does gluten mean?
Gluten is a protein in wheat. Actually, gluten's a protein in almost all grains. But there's a toxic family of glutens that's in wheat, rye, and barley, and all the derivatives of that, like couscous and spelt, Polish wheat. Any derivative of wheat, rye, or barley has this toxic protein of gluten in it.
When you were talking earlier about headaches, you said they didn't have celiac, they had gluten sensitivity.
Right.
What's the difference between the two?
Think of an iceberg, and above the waterline you see some ice. That's the topic of gluten sensitivity. Below the waterline, if it manifests in the intestines, it's celiac disease. If it manifests in the liver, it might be autoimmune hepatitis or liver cancer. If it manifests in the brain, it might be attention deficit or epilepsy and seizures or schizophrenia or migraines. That it just depends on the tissue where it manifests as to what the symptoms are, but the big picture is gluten sensitivity.
So it's like a trigger?
Yeah.
Different conditions, right?
Absolutely, it's a trigger.
And it doesn't have to be like a lot of people out there, they just consider gluten sensitivity to be associated with the gut.
Right, that's because it was first recognized, the symptoms were first recognized associated with the gut, that when they stopped eating wheat, the gut pain went away and they felt better. So they thought it's a gut disease. And when they came up with the endoscopy in the 1950s, a tube going down the throat looking at the intestines, snip a little piece, look at it under a microscope, they could see all the damage from eating wheat, stop eating wheat, and everything healed. But if the first test they'd ever done was to go up one of the veins and look at the brain, they would have seen the damage and thought it was a brain disease. But the first test looked down here, so everybody has thought it's a gut disease, it's a gut disease. It may be a gut disease, but it's not exclusively or not even primarily a gut disease.
What percentage out there actually has gut dysfunction?
For every 1 person that has gut dysfunction, there are 8 that don't.
Really? Really? Wow. So it can manifest itself in many different ways.
In your kidneys, in your skin, you might just have acne. You could, like your liver might not be working well, so you don't metabolize alcohol very well. It could be prostate problems. It could be you can't think clearly, you get foggy brained. And
it's all coming from, for a lot of people, it's coming from the base of the food pyramid, what the government says that we should be consuming. 7 to 11 grains or servings of grains, rice and pasta per day.
Right. Grains aren't necessarily bad. There's a school of thought that says don't eat so many grains, and that's a good school of thought. But grains aren't bad. Toxic grains are bad. So if that grain is toxic to you, it's a problem to you. And right now we know that it's about 7 out of 10 people have a sensitivity to gluten.
7 out of 10?
7 out of 10.
Wow, that's
huge. It's a silent epidemic.
Now, in terms of testing, what has been the traditional approach to testing for gluten sensitivity or celiac disease?
Good. For gluten sensitivity, the test has been to look at antibodies to one of the proteins of gluten called gliadin. And many times that would come back negative for celiac disease, but then they do transglutaminase and they'd find that that was positive, and they'd look and they see, yes, the damage is in the gut. So they've thought that the gliadin test isn't very sensitive, so you really can't count on it. Well, with the information they had at the time, that was accurate, but now we have much more information. Think of a brick wall. Proteins are made up of amino acids, sometimes hundreds of amino acids. Digestion breaks the amino acids down, or breaks the protein down into each brick of the amino acids. So digestion takes away the mortar, and the brick comes off, and you could stack the bricks, and each one's a different amino acid. When we absorb nutrients, we absorb the amino acids through our intestines, and you can absorb a single amino acid, or even a double still stuck together. That's called a dipeptide. Nothing larger than that's supposed to get through the intestines. But with wheat, rye, and barley, the body can't break it down into the bricks. It breaks it down, it's like somebody took a sledgehammer to a brick wall and broke it into clumps. There's 33 amino acid clumps, 17, 15 clumps. Way too big to get in through the gut into the bloodstream. But the one that they test for, the one they've always tested for, is the 33 amino acid called gliadin. Well, now, and that's why the tests were wrong, was because some people don't react to that 33 amino acid. They react to the 17, or to the 11, or to the 15. And so it's not that the concept of testing the peptides was wrong, it's that the concept of testing just one peptide was wrong. Papers have come out, we now know that 50% of celiacs have antibodies to gliadin, the 33-mer amino acid. It's the prominent peptide someone may have a reaction to. But what about the other 50%?
Yeah, we're missing a few.
We're missing a few, right? That's why they say it's not a sensitive test. Well, it is a sensitive test if they have gliadin sensitivity. But they may have the 17, or the 15, or the 11. So now tests have come out that look at 10 different peptides of gluten instead of just the gliadin, the one peptide.
So if someone in our audience has tested, they did the transglutaminase test, or they did the, I can't remember the other one.
Gliadin.
Yeah, the gliadin test. How often do they miss?
50% of the time they'll miss on the gliadin. Now on the transglutaminase part, that's looking for actual damage in the intestines.
Tell us about the shags.
Okay.
Yeah.
The inside of your intestines are a tube. It's about 25 feet long, a little more or less. The inside of the tube is lined with shag carpeting. This shag is where calcium is absorbed. This shag, vitamin C. This shag, the fish oils. All the shags absorb different nutrients. When you have celiac disease, your shags wear down and you get Berber instead of shag. So if you've got Berber, you don't absorb calcium. You get osteoporosis. It's not rocket science. As to why do celiacs get osteoporosis, it's so common that the Annals of Internal Medicine say every celiac patient needs to be tested for osteoporosis, as celiac could be the cause of their osteoporosis. So I present that study in my seminars to doctors. Says, docs, if the Annals of Internal Medicine say everyone needs to be tested, which one are you not going to test? Right? So that kind of gets them thinking about it. So the shags wear down. If you have the shags worn down, the blood test called transglutaminase is close to 100% accurate and sensitive, right on the money. Some papers say 97%, 95%, but right on the money. So doctors are very confident in that test. The problem is, when they determine that it's right on the money and it identifies 95 to 100% of the people, they're looking at people who have celiac disease. The definition of celiac disease requires that you have Berber, that you have total, it's called total villus atrophy. Your shags are worn down, your villi are atrophied completely. If you have partial villus atrophy, the test can be wrong up to 7 out of 10 times.
So you can be marching your way toward Berber and just not quite be there, and it would just be...
That's right, and the test can be wrong 7 out of 10 times.
Wow.
So that's like saying, have you ever had someone that had a heart attack and they survived and they said, you know, my doctor told me I had a previous heart attack and I never knew. You ever heard that before?
Yeah.
That's because there's damage in the heart that they could identify. And when they saved them from the heart attack, they found that there was damage from a previous heart attack. So if we use the same logic that they use with celiac disease, a cardiologist would say, oh, you don't have any heart disease. No, there's no damage to your heart. Doesn't matter if your cholesterol is 350 and your pipes are all plugged up. No, you don't have any heart disease because there's no damage to your heart. No, you don't have celiac disease because your shags aren't worn down completely. It's early thinking, historic thinking. And the more current thinking is you want to identify it earlier.
Right.
When there's partial villus atrophy, or maybe there's no atrophy yet, there's just all the inflammation in the gut that causes the atrophy. That's called increased IELs, intraepithelial lymphocytes. Maybe that's all there is. And the transglutaminase test would not identify that up to 7 out of 10 times.
Now, if someone has gluten sensitivity or celiac disease, can they just have a little bit of gluten every once in a while, or should they just keep away from it?
Well, I like to say, you can't be a little pregnant.
I like that.
You can't have a little gluten. You can't. There was a case published in the literature of a 34-year-old woman. She went to a celiac specialty clinic. She'd been diagnosed a year earlier with celiac disease. She told to go on a gluten-free diet. She went on a gluten-free diet. She didn't get better, so she went to a specialty clinic. They did the blood work, and they saw that her antibodies were sky high for transglutaminase and gliadin. They did an endoscopy. She had the worst possible wearing down of the shags that you could have. It's called Marsh 3C, very worst. She had osteoporosis, 34 years old. Her hair was falling out. She was the shortest girl in her class growing up. She didn't get her menstrual cycles with the rest of the girls in the class. She's about a year and a half late. That's called failure to thrive. Shortest person in the class, organs are not developing properly. She had chronic fatigue and a couple of other things that I don't remember. So they said, "Madam, you must give up wheat." I did give up wheat. Completely? Yes. Well, I had a piece of cake last month or something, maybe a crouton on a salad. No, you must give it up completely. Okay. So she gave it up completely. She came back a year later. Her blood tests were now high normal or just over a little bit in the high range as opposed to sky high. The endoscopy, though, was still Marsh 3C, no change at all. Her energy was a little better. Her hair wasn't falling out as much. Still had osteoporosis. A number of symptoms were still around. "Madam, you must give up wheat." I did give up wheat completely. And they were baffled. They checked her diet. She had given up completely. They were baffled. They were about to call it refractory sprue, which of course is a nice fancy Scrabble word. And it means, we don't know why you've got this. That's all it means. When a really sharp doc said, "Madam, are you a religious woman?" She was a nun in street clothes. It was the host. She was getting the host every day. "Madam, you must give up the wafer." "I will not. God will not allow it. We can't help you." So they went to the bishop and they got a wafer and they asked him to break it into the pieces that he gives to parishioners, and they did, and there were 4 pieces. So they analyzed each of the 4 pieces, and it averaged about 1 milligram of gluten in each piece. How much is 1 milligram of gluten? Cut your thumbnail in half, cut it in half again, that's 1/4. Cut it in half one more time, that's 1/8. 1/8 of a thumbnail of gluten is 1 milligram. That's how much it took for her to have total villus atrophy, high risk of cancer of the intestines, osteoporosis, hair loss, chronic fatigue. So they published their paper. 1 milligram of gluten a day keeps the villi healing away.
Really?
Cute little title that you don't see very often in the medical literature, right? Unbeknownst to them, she gave up the wafer. The bishop made her give up the wafer. She came back a year and a half later, she was radiant. Just vibrant energy, a flock of hair, dynamic, osteoporosis gone, blood tests low normal, endoscopy completely normal. It was 1/8 of a thumbnail.
Now, is this just for people who have celiac or people who are gluten sensitive?
We don't know. We don't know about gluten sensitivity, but now with the new testing that's out, we'll be able to monitor and recheck and see. Can they have some in the future? But it's extremely dangerous at this point to think when your symptoms go away, it's okay to have gluten, because it contributes to the development of the number 3 cause of death in this country, which is autoimmune diseases.
Right. I want to touch on that in a minute. Is this something that can shorten someone's life?
A paper came out a couple of years ago that said children diagnosed with celiac disease have a 3-fold increased long-term mortality on a gluten-free diet. If children are diagnosed with celiac disease, they die early in life. Even trying to be good, they die early. And there's not enough time today, but perhaps another visit will do it. Another study where they looked at 10,000 celiac patients, just over 10,000 celiac patients. And they looked to see if they had a certain disease, and this was in Sweden where they've got social medicine, they've got records on everyone. So they compared people with asthma that had celiac disease and people with asthma that didn't have celiac disease. Was there a difference in their death rates at the ages they died, or many diseases? And it turned out there was. If you had asthma and you had celiac disease, you were 2.9 times more likely to die early in life than someone with asthma without. With kidney disease, it was 6 to 1, 6-fold higher. That's 500%. more likely to die early. And went all down the list, but the real shocker was inflammatory bowel diseases. That's colitis and Crohn's. And most of us have friends that have colitis or Crohn's. If they have celiac disease, their standard mortality ratio, meaning their likelihood to die early, is 70-1.
What does that mean?
They not 10% more likely to die early, or 20%, or even 100%, which means double. They're 700% more likely to die early in life if they keep eating wheat and they've got colitis or Crohn's.
That's amazing. Autoimmunity. What's the link between gluten sensitivity, celiac, and autoimmunity? Because autoimmunity, like you said, was the number 3 cause of
morbidity and mortality.
Right. Wow. Right. Tell us about that. Tell us about that link.
You know, okay, docs think of autoimmune diseases as separate. Like if you have psoriasis, you go to a dermatologist. If you have MS, you go to a neurologist.
Real quick before we go on, what is an autoimmune disease?
An autoimmune disease means that the immune system is attacking your own body. It's attacking your joints, you get rheumatoid arthritis. It's attacking your skin, you get psoriasis. Mm-hmm. It's attacking your hair follicles, you get alopecia areata.
Gotcha.
And they look like you.
Dang good, you know what I'm saying?
So that's an autoimmune disease. And autoimmune diseases, if you look at them together, the mechanism is very similar for all of them. It just depends on where their genetic weakness is. You know, you pull at a chain, it always breaks at the weak link. It's at one end, the middle, the other end. It's your kidney, your liver, your brain, your heart. Wherever your genetic weak link is, that's where you're going to break if you keep pulling on the chain. Mm-hmm. And autoimmune disease is a pull on the chain, and so it breaks at the weakest link. We know that there are 3 factors required for autoimmune disease. You have to have the genetic vulnerability, you have to have the environmental trigger that ignites it and sets it off, and you have to have intestinal permeability or the leaky gut. Mm-hmm. So the genetic trigger, the most common genetic trigger is gluten. That's why autoimmune disease, number 3 cause of death, early death, and being sick, that's called morbidity, is getting sick, and mortality is death. It's number 3 cause is autoimmune diseases. That's why celiac patients have 10 times the number of autoimmune diseases of the rest of the population. 10 times more. That's the link, is that gluten is the fire that pulls at the chain and you break at the weak link, and that's the symptoms you get.
Have you ever seen anyone's autoimmune issue resolve by way of taking out the gluten?
Many times.
Really?
Many times, and it's in the medical literature. Reversing what looked like ALS, Lou Gehrig's disease. And I don't know if you know, but if you're diagnosed with Lou Gehrig's disease, you have a 2.5-year lifespan. There's no treatment for that. But it reversed. Reversing schizophrenia, card-carrying schizophrenia on heavy medications in a mental hospital, put them on a gluten-free diet, they were better in days. Within 6 months, they were off all medications.
Wow.
Children with drug-resistant epilepsy, that means they get seizures and the drugs don't work. Imagine if that's your child and you've been to 2 or 3 neurologists, tried a number of drugs, they don't work. Children with drug-resistant epilepsy, 50% of them go into complete remission, meaning no more seizures, on a gluten-free diet. So it just depends on where the weak link is, as to where it shows itself.
Well, let's touch on 2 more. Hashimoto's hypothyroiditis.
Right.
Very common.
Very, very common. Probably the second most common autoimmune condition with gluten sensitivity. The first is diabetes. The second is Hashimoto's thyroiditis.
So if you got Hashimoto's, you should certainly stay away from gluten.
You should check to see if you have gluten, because if you go on a gluten-free diet, sometimes you can't tell. You feel a little better, but you can't tell if it's going to help your thyroid because you still might be tired, or you might get cold, or the other symptoms. It takes 6 months to a year, and we've reversed the antibodies attacking the thyroid many times in our patients.
Type 1 diabetes.
Type 1 diabetes, it has the same genetic vulnerability as celiac disease. They're similar genes, and it's extremely common. We now know that if the baby is kept away, actually, this is really interesting. A couple of papers have come out that showed if the baby is born of parents with type 1 diabetes, the vulnerability of that baby to developing type 1 diabetes is very high. If they titrate and give that baby a little bit of gluten at the right age, between 3 and 6 months, just a tiny little, like an eighth of a thumbnail every once in a while, the baby builds a tolerance up to gluten. And then they don't give the baby gluten in their life, but when these kids go to school, they get it sometimes and all that. Those children are much less likely to develop type 1 diabetes.
So I'm sure our audience is out there freaking out, wondering, is that me? Is that me? We talked earlier about the traditional testing and how it's not the greatest. There's new improved testing out right now, right?
There is.
Tell us about that.
Good. A new lab opened up just a few months ago called Cyrex Labs, C-Y-R-E-X, and cyrexlabs.com. And your audience wants their doctors to go there and register and learn about these tests. And they're such wonderful tests, and they're not expensive. They're reasonable, and you can more clearly identify this sensitivity. If your doctor refuses to do this, you go to my website, which is thedoctor.com, THEDR.com, and I have a list of gluten coaches. These are docs who have been in my all-day seminar, and they've passed an exam to make sure they got the information. And there's a disclaimer that says I can't guarantee anything about these docs other than they sat in the seat and they heard the information, so they should know what to do about this. But at least it gives your audience someone they can go to and feel comfortable that they know the information. But in any event, find a doctor that will order these tests for you. There are 4 tests. The first test is a saliva test. It's a really good general screen. It only looks at gliadin and transglutaminase, so it's not looking at all the peptides, so it's going to miss some. But it's inexpensive as a general screen, and for children or those that don't want to do blood work, you can just spit in a tube, and it's as accurate as the blood work for total venous atrophy.
Gotcha.
So it'll come back positive as often as the current blood work does. The other 3 tests are blood tests, and one tube will do all 3. I don't recommend you do all 3 at once. Panel number 2 is looking for intestinal permeability. It's the most accurate measure of intestinal permeability that you can get. It's wonderful. Panel number 3 looks at the 10 peptides of gluten, and panel number 4 looks at cross-reactive foods. I'll talk about that in a minute if you like. I recommend that people do panel number 2 and 3. Look for the leaky gut and look for the multiple peptides of gluten. If number 3 comes back positive, then call the lab and do number 4. You don't have to do another blood draw. They save the blood for 60 days. So if 3 comes back positive, you've got antibodies to gluten, then you want to look at panel number 4, the cross-reactive foods.
What does that mean?
There are foods that react as if you're eating gluten. You're not eating gluten, but it's as if you're eating gluten.
So is this for somebody who gets rid of the gluten, but they're still eating rice?
Yeah,
They still
yeah,
feel well?
and they just don't feel great. They feel better, but they don't feel like $1 million. My position is, if you're going to all this trouble to take care of yourself, you should feel like $1 million.
Right.
If you don't feel like $1 million, we're missing something. So the cross-reactive foods, unfortunately, if you have this sensitivity, it's foods like chocolate. And if you have a sensitivity to chocolate, your body may think you're eating gluten and make the antibodies fighting gluten. Not everybody's got that sensitivity to chocolate, but if you have it, you really want to know. Or coffee is another one. Or oats. There are 24 on the panel. 13 of them actually cross-react, and the others are foods that we're eating way too regularly. If you go on a gluten-free diet, you start eating amaranth, or quinoa, or hemp more often. Good foods, really good foods. But if you start eating them regularly, you never developed oral tolerance as an infant to those foods. It's something the immune system does. When we're babies, we taste food, and the immune system says, oh, that's okay. That's celery, that's good for us. Oh, that's bad bacteria from potato salad? No, that's not good. Fight that. And the body makes oral tolerance when you're an infant. But we never ate quinoa or amaranth or hemp when we were infants. So we don't have oral tolerance. So if you start eating those foods regularly, which is recommended on a gluten-free diet, your immune system can get overwhelmed and say, this is a problem, we need to fight this.
Right.
So that's panel number 4, looks at that test.
Right, and that's Cyrex Labs, so cyrexlabs.com?
Correct.
Right on. Obligatory underground wellness show question. What did you eat today?
Well, let's see. It's mid-afternoon. Breakfast was 3 eggs, over hard, break the yolk, side of Spanish rice, some black beans, and a little avocado. I mix it all together. Lunch, I actually had to hurry to get here, so I had 2 shrimp egg roll, not egg rolls, spring rolls from Whole Foods that are wrapped in rice paper.
Gotcha. Gluten-free, right?
Gluten-free, all gluten-free.
Dr. O'Brien, thanks so much for coming on.
Thank you, Sean.
Check out the doctor at thedoctor.com. Check out the entire interview, the whole thing at undergroundwellness.com. We're out of here, guys.